Welcome to the Baptist Medical News Network. I'm Rhonda McRae. Thank you for joining us for our webcast today. Our topic is finding hope during cancer. And here to help us with that is clinical psychologist Dr. Bufkin Moore. Thanks for coming today, Dr. Moore.
Thank you for having me.
He is a clinical psychologist on staff here at Baptist at the Hederman Cancer Center. So this is a great topic, an important topic for anybody who is either being treated for cancer or maybe has a loved one who's undergoing cancer treatment. So we appreciate you coming to help us today. So let's just jump right in. First question, Dr. Moore. How important is it for cancer patients to find hope and for their families to find hope? Is there any evidence that it could have any impact on their outcome?
Well, that's a great question. One of the things that we've found with cancer is that it is almost universally devastating as a diagnosis, and finding hope in the midst of that can be very difficult, can be very trying, but it ultimately, at the end of the day, without hope, you're kind of a lost ship, and so it is so important for people to find hope. Okay.
Well, another question then, finding hope. I mean, everybody's a different person. People respond differently to different things, but are there, certain things that just about anybody can do during those circumstances that will help them to find hope and remain hopeful?
There are. One of the most critical things from a psychological perspective is reaching out to support and being available to support. There are a lot of studies that show that the more support people have, the better their outcomes are, and the more widespread their network of support, be it family, friends, church, work, co-workers, or ironically, people that patients meet in the waiting room of the cancer clinic. Those who report more hope and more support tend to do better in the long run.
So that's the first thing, a big network.
Support is probably, I tell people all the time, probably the most critical aspect of successfully dealing with cancer. It is one of the things about cancer. It's just a very evil and cruel disease, and it likes to take everything that it can from you, and it certainly takes parts of your body. It takes some of your chemistries change as a result of your treatment of cancer. But on a deeper, more kind of metaphysical level, it can get its hands around your hope, and if once it kind of takes grasp of your hope and starts to pull that away, that's when we see people not do well. And so our entire mission at the Cancer Center here at Baptist is to instill hope in people and to kind of just encourage and nurture and do everything that we can to facilitate their becoming more hopeful throughout this process, because we know that hope is a precious commodity, and it's something that certainly we start out with on the inside, but our resources are limited, and it's not kind of a self-producing commodity, and so we rely on other people to pump it in. And so when our tanks kind of get empty with hope, we look to others to kind of infuse us with hope. And when we see that happening, it makes us very happy at the Cancer Center. Patients do better. They report less distress, less anxiety, less worry, just general kind of feeling better about their situation and their condition.
Well, that raises the question, your hopefulness can have an impact on how you're doing physically. Is the reverse true? Is how you're doing physically, are there things that you can do, like, for example, I know when I'm tired, it's hard for me to be even in a normal mood as a healthy person. So if a cancer patient is struggling with hope, often something as simple as getting a nap or just getting rest?
Sure. Yeah. A lot of times it's kind of going back to the basics of just general health and well-being. I mean, we encourage people to take care of themselves, to know their limits. If you're tired and you're exhausted, which is, fatigue is the #1 reported side effect of all cancer treatments, you have to rest and you have to take care of your body. If your body starts to suffer, your mind is not going to be far to follow. And when your mind starts to suffer, that's when hope starts to slip away. And so whether it's taking a nap, whether it's saying no to certain responsibilities or obligations that you can say no to, by all means do that. Mild to moderate exercise is always a good idea. just to keep your blood flowing and to keep your blood circulating kind of to all the different parts of your body, and most importantly throughout your brain, so that you're getting enough oxygen and enough nutrients in your head that can help stabilize your neurochemistry, that can help you feel less depressed or less stressed and anxious and worried, and can in turn give you more of a sense of control over this disease, which is a big deal. Kind of having control when you're fighting something like cancer can go a long way.
So that may be another case in which that support can come in. If you need time for a nap, your support group can help you with your responsibilities. That's right. So you have time for a nap.
We always tell people, let whoever wants to help you, let them help you. And in the South particularly, and this may be kind of a universal thing, but we have a lot of good caregivers, and we're kind of raised to take care of people and to meet needs and to help people in any way that we can. Sometimes we find it difficult to be caregetters, and it's in the battle for hope, it's important to be able to get care as well as to give care. But when you're the patient and when you're not feeling well and people are saying, I can do this errand for you, I can take care of your children, or I can take care of your parents, or whatever the case may be, we always encourage people to take advantage of those things, because A, it doesn't come around that often, and B, it really does take a load off of your shoulders so that you can focus on what you need to focus on, which is battling this cancer, doing better, feeling better, and fighting better.
Well, all this kind of leads to a question just about basic temperament for me. Some people tend to be a little more glass half full versus glass half empty. Some people are naturally, just in their normal disposition, are a little more hopeful. So
that's right.
If a person maybe tends to be a little more of the glass half empty disposition, and maybe struggle with hopefulness anyway, are they at the mercy of their temperament, or can they learn to be more hopeful?
Well, that's a good question. They certainly can. It raises the question of kind of optimism and positivity, and there's a lot of research that's been done about what kind of attitude works best with cancer, what kind of mentality or attitude or mindset tends to help people do better in the fight against cancer. And the results are pretty surprising. It's not necessarily the people who are, quote, positive. And by positive, I just mean happy and always kind of upbeat and that sort of thing. The results of many of the studies say that those who do better in the long run tend to have more of a kind of a crotchety kind of attitude. It's people who are aggressive, people who are confrontive, people who they refuse to kind of bow down to their cancer, and they kind of have what could be construed as maybe a slightly raucous personality. But these things can change. You can teach people, and folks learn all the time. Your disease, your cancer is what you make of it, and some things are set in stone. We do everything that we can from a medical perspective to kill cancer, to remove it from the body. But we understand that there's a whole other element at play here, and the mind and the body have such an intimate and integral connection that we know that a strong mind can do wonders in the fight against cancer. And the flip side of that is when your mind starts to falter, and when you start to doubt yourself, and when your self-confidence and that kind of positivity tends to leak away, it affects your will to live. And I think that's ultimately, no matter who you are and no matter what your diagnosis or prognosis, anyone who's diagnosed with cancer is faced with the ultimate in what it is to be a human being, and that is to face your mortality. And obviously we all deal with that differently. But if we can kind of gain a sense of control over it and do everything that we can to help the patient maintain optimism, maintain a sense of hopefulness, maintain what we would call kind of a will to live, we're satisfied. And these are things that you can't measure them. There are no blood tests or X-rays for hope and for attitude. We can always, we can ask people, how are you doing? How are you feeling? But we can't measure it like they can, a tumor or any type of blood marker or anything like that. So we kind of rely on the good old fashioned, we talk to people and we encourage and we nurture and we support, and that's kind of what we're all about at the Cancer Center at Baptist.
Well, that raises another question. Optimism, cheerfulness. If you have a family member who is dealing with cancer and you want to be supportive, is cheerfulness the same as hope, or is it kind of worse?
It's interesting, and we get mixed kind of reviews on this. The general consensus is that there's a woman named Dr. Jimmy Holland, who is a psychiatrist at Memorial Sloan Kettering Hospital in New York, who has done groundbreaking research, and she's kind of the grandmother of a subspecialty of psychology called psycho-oncology, which is the psychological, psychosocial aspects of cancer and its treatment. And what she refers to is the tyranny of positive thinking. One thing that I hear all the time as a psychologist talking with cancer patients is they can really tend to feel alone when they're outside of this kind of safe zone of the cancer center. When they come into the cancer center, they're surrounded by people who are going through exactly what they're going through, people who have been through what they're going through, people who can shed light on their paths and who can offer kind of wisdom and support. Outside of the cancer center, in the community, you may say, there are a lot of folks who well-intentioned, and they mean the best, but they want to be positive and they want to cheer folks up. And that can ultimately serve to alienate the patient and make them feel more alone because they feel a pressure to be positive. And people are telling them, oh, you look so good, and I hear patients say all the time, well, everybody tells me I look good, but, if you could crawl in my skin for a minute, I don't feel good. And so it creates this discrepancy between what they feel they're expected to be, which is happy and positive, and what they actually feel, which is not so positive and not so happy, and they may feel unwell. Getting away from the question a little bit, but I think it's important for caregivers to know that it's okay. And I think patients really value someone being honest with them and saying, hey, how are you doing? Kind of giving them the opportunity to say, I'm doing great, or I'm not doing so great and I need a little help. It's always best to ask the question of the patient rather than assume the response of the patient, if that makes sense.
It does make sense. So from a caregiver's perspective, or a friend even, what is the appropriate way then, other than, as you suggested, asking the question and letting them, what are other things that those people can do to really be supportive of the right kind of hope during cancer treatment? Well,
obviously, we want caregivers and friends and loved ones. They are an integral part, a critical part of cancer treatment and the success of cancer treatment. Cancer is a family illness, and when I say family illness, I mean people in your cancer family. And this is just everybody who cares about you, everybody who loves you and supports you and wants you to do well. It affects your caregivers as well. But caregivers typically, they need to jump in and do everything that they can, relieve the patient of responsibilities if they can, cook a meal, rake the leaves, mow the yard, offer encouragement, offer support. I mean, just a kind word goes such a long way, and it means so much more. I hear this all the time. Someone has kind of skated through life and they haven't had that much adversity or difficulty, and they've taken a lot of things for granted and taken a lot of people for granted. And in the course of their cancer journey, those little words of support and encouragement, not necessarily being overly positive, but just the kind of, hey, how are you doing kind of questions. Just the, I care about you and I want to know how you're doing and I want to know how I can help you. Those are probably the best questions and the best response that that a caregiver can have. And with that said, caregivers have to take care of themselves. I mean, caregiving carries with it an unbelievable burden. It can be extremely taxing for the caregiver to take care of the patient. And we know that the patient cannot fight optimally unless they're getting optimal caregiving. And so we are also available and constantly are dealing with caregivers and caregiver issues. There's something called caregiver fatigue, which is a kind of a new concept, but it refers to the tendency of caregivers to burn out and just feel the burden and the stress, and the disease takes its toll on them as well. Mm-hmm. So caregivers have to kind of extend their net out as well to receive support and care.
We keep coming back to the theme of support.
Mm-hmm.
So I see from your comments that support is important for everybody involved in the cancer care of the patient and the friends, the big net.
That's right.
Casting the big net.
Mm-hmm. Yeah, obviously, the patient is the priority, and eliminating cancer is the number one priority. But when you get outside of the kind of the physical realm of tumors and blood work and CT scans and chemotherapy and surgery and radiation treatments and that sort of thing, we get to you really get into what I would refer to as the human side of cancer. And it is all about support. It is all about support from top to bottom. Patient, of course, is the priority, but we know that caregivers have their own burdens and their own issues, and we want them to be able to express those needs and get those needs met as best they can. It's tough, though.
Okay, so to kind of recap, thinking about remaining hopeful, it's not just the sort of mental things you do, not just the being tough, it's reaching out to friends, it's also the physical things you do, taking good care of yourself, rest, exercise, good diet, all those things can help you.
All those things can help.
Okay.
That's right. It's the whole package has to be there, and if it's not, it's not devastating if the whole package isn't there. But in an optimal situation, you've got someone who is eating right. They're taking care of themselves. They're continuing to kind of do surveillance. Let's say a woman is diagnosed with breast cancer. Well, with lung cancer, she still needs to have her mammograms and do her self-exams. It's exercising as much as you can during your treatment. We don't want folks to isolate and to kind of become sedentary, which is a real big tendency. When you're not feeling well, you just want to kind of stay in bed or stay on the couch, and we sometimes feel like cheerleaders. I mean, we just try to give folks pep talks and encourage them to get out, whether it's walking around the block or walking around the den, whatever they can do to get that blood circulating, to get the oxygen way down into their lungs, to just moderately exercise. That's a great thing to do, and generally to not over-identify themselves as a cancer patient. They're a person, and they shouldn't be identified as a cancer patient any more so than they're identified as a headache patient or a measles patient or a flu patient, whatever they had in their past. I mean, this is something that's happened to them, and they have to learn how to work with it and to embrace it and to kind of deal with it. But we don't like folks to become over-identified with their cancer. Their
lives are more than cancer.
So much more than cancer. These are people. These are human beings, and they've been affected by this disease. But you're exactly right. They are so much more than cancer. And we see that time and time again. Cancer it loves to take that away. It loves to just impose itself in all of its facets and kind of overcome or overtake the patient. And the sad news is when that happens, it's tough to recover from that. And so that's why we say, it takes a fight, it takes a village, it takes a lot of folks kind of pushing and pulling and encouraging and motivating and nurturing to get that patient kind of out of the woods and back to what we refer to as their new normal. They'll never be normal again. With the diagnosis of cancer, it's a life-changing thing. to be sure. But many folks would say it's not the worst thing that's ever happened to me. And actually, I've heard several people say it's the best thing that's ever happened to me. Changes your priorities, gives you an opportunity to reflect on the things that are important to you, the things that matter, gives you the opportunity to stop doing things that don't matter, start doing things that do matter. And that hope that you have, if it remains intact, can be gifted, can be given to someone else. And if we can kind of spread that, which is it's an infectious thing, when we have our support groups or other meetings, and people will show up discouraged and kind of down about their situation, there's always one or two people there who are full of hope and full of encouragement. And I can't tell you how infectious that is and how wonderful it is to see one person spreading this hope to other people. And it's kind of like a pyramid kind of thing. It continues to trickle down and affect other people. It's a wonderful, wonderful thing to see.
Well, it's just great to know that even in the midst of a really tough fight that cancer involves, that is definitely possible to find hope and to remain hopeful. And thank you so much for coming today.
You're welcome.
Give us these techniques and the great information for
You're welcome.
both cancer patients and people who are helping them. And for our viewers who are watching, I want to just make you aware of Bufkin, Dr. Moore is going to be doing a free seminar called 5 Positive Things About Cancer. That's going to be coming up March 9th at 12 noon right here at Baptist at the Hederman Cancer Center. There's going to be a $5 optional lunch available for people who pre-register, and you can do that by calling our health line at 601-948-6262 or toll free 1-800-948-6262. So if you're involved in a cancer treatment or you're helping somebody who's doing that, don't miss that. That will be a great opportunity for you to come and get some of that support and more information from Dr. Moore on that. And just remember, this is February, it's Heart Month, so we want to just remind you that there are things you can do for your heart health as well. Here at Baptist, we have low-cost heart screenings every day, and we want you to go on our website and read about those, get complete details about our heart screenings too. So for the heart screenings, you can go to www.mbhs.org/cardiovascular and just spell out the word cardiovascular, and you can get details about all our screenings there. So, Dr. Moore, thank you again for coming today.
Yeah.
I hope you'll tune back in next month. Our speaker is going to be Dr. Ashley Pullen. She is with Baptist Medical Clinic Family Practice. She's going to be talking about getting ready for springtime allergies. So if you tend to have difficulty with those allergies, you definitely want to tune in to find out what you can do to make your springtime a little less allergic. So we hope you'll tune in, and thank you for joining us.